dangerous mistakes.
They just nearly killed my dad, and nothing's happening.
Disturbing revelations.
It is absolutely a safety issue.
And a system that failed an Ohio family.
Where is the oversight? Whose side are they on?
Tonight, our News 5 investigation raises serious questions about how Ohio regulates the industry that cares for the most vulnerable among us.
Here's News 5 investigator Sarah Buttison.
We just assumed that it was the place that it had always been.
So, on November 1st of 2021, then 88-year-old Garrett Murray moved in.
My mom and he always wanted to be at St. Mary's of the Woods.
Now a widower, the grandfather of 10 made a new home at the assisted living facility in Avon.
My dad is a very religious man, and he's very Catholic, and so I joked that it was a match made in heaven.
But just 10 weeks later,
this time we thought he was done.
Garrett was hospitalized. His daughter Nora says her dad was near death.
We gathered around his bedside and told him that it was okay and he could go be with my mom.
Records show he had severe hypothyroidism. It is life-threatening, especially if you're elderly. The diagnosis was also a surprise. After all, Garrett was prescribed medication that kept his thyroid under control. Medication his family paid St. Mary of the Woods to administer to him.
Because his mind was starting to go a little bit and his memory was a little suspect, so we wanted help.
Determined to know what went wrong, Nora filed this 12-page complaint with the Ohio Department of Health. A state inspection found St. Mary of the Woods was in compliance. No licensure violations were cited.
To look at this state form, you would never know anything went wrong before Garrett ended up here. But is that true? The surveyor's own notes tell a different story.
Through a public records request, Nora obtained proof of what she and doctors suspected. It appeared Garrett had missed his medication. The surveyor wrote the facility failed to accurately document the administration or lack of administration of resident medications, noting the review of medication charts revealed missing signatures.
Somebody, we don't know who, somebody put initials in the boxes for days and times that my father wasn't even in the facility.
Should that have happened?
No, I mean, it should never happen.
Lauren Anthus is a health policy expert at the Center for Community Solutions, a Cleveland think tank.
I think the accountability measures that we have in place are not really sufficient.
Especially since it was not the only substantiated allegation. On December 30th, 2021, Garrett fell. Nora complained her father laid on the floor for about 3 hours, waiting for help. The surveyor found St. Mary of the Woods failed to provide the care and services to reasonably prevent resident falls and provide timely care thereafter. But again, the facility was not cited.
Can you explain why?
Yeah, that happens fairly regularly.
Peter Van Runkel runs the Ohio Healthcare Association, the senior care industry's lobbying group. He says it's not unusual for the Ohio Department of Health to issue no citations, even when it substantiates claims.
So, there can be a lot of shades of gray of any situation. They're all going to be a little bit different.
It leaves me wondering, what do you have to do to actually get cited or fined? Actually kill somebody?
The Ohio Department of Health declined our interview requests. In an email, a spokesperson wrote they cannot comment on an individual complaint, but that many factors go into the decision whether to cite a facility. Atrium Living Centers, which owns St. Mary of the Woods, also declined our requests. An employee told the state the biggest problem is staffing, and they are doing everything in their power to properly care for their residents.
We know personally so many families that had great experiences there, and I'm sad. I'm sad that they're no longer that place.
After 2 weeks in the hospital, Garrett moved to a new facility where he spent another 3 months recovering. Nora noticed her dad's dementia has deepened. Her trust destroyed.
If there's an industry where there's no consequence, how can we be assured that our loved ones are ever being taken care of the way we are hoping that they are?
We also found the Ohio Department of Health doesn't make it easy for families to find out what's happening inside assisted living facilities. When an inspection happens at a nursing home, reports like this are posted online, but the same types of inspections at assisted living facilities are not.
And Sarah, tell us, why is that? Why can't you get those reports online?
I asked the state again and again. They cited privacy concerns for residents, but at least in this report, no residents are named. They're given a number.
All right, Sarah Buttison, amazing story. We appreciate that. We'll know you will continue to follow up. Thank you very much.